Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rankus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you, everything from nutrition and mental health to alternative therapies and natural living.
We'll bring you the expert interviews, insightful discussions, and practical tips to make motherhood a little easier and help your family thrive.
Please keep in mind that this podcast is for informational and educational purposes only and is not intended to replace the advice, diagnosis, or treatment plans you have with your personal healthcare team. Please have a conversation with your trusted healthcare provider prior to making any changes or implementing any strategies or advice you learn from this podcast.
Whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Here at the Motherhood Alliance podcast, we challenge the status quo, ask the tough questions, and offer a supportive community for moms who want to make an informed, holistic choice.
Thank you for joining us on this journey.
Let's get started. Hi, we are Britt and Andrea from motherhoodalliance.com, and we're excited to welcome you to a 4-episode series with Dr. Veronica Tovar, a Greenville-based dentist who has taken whole body health to an entirely new level. Beyond traditional dental training, Dr. Tovar has trained with some of the top institutes in airway health, myofunctional therapy, oral restrictions, dental sleep medicine, sedation, laser dentistry, you name it, she's probably had some training in it. She's an ambassador with the Breathe Institute and a Breathe Baby affiliate. She's also a Vivos and tooth pillow provider. What really drives her, though, is the belief that the mouth is the gateway to the rest of the body, and the ripple effect she sees when patients finally feel better, breathe better, and realize they didn't have to live feeling the way that they did. As a mom herself, she is especially passionate about helping future generations grow and thrive optimally, and she loves supporting mothers through healthier breastfeeding and airway journeys. Outside of her practice, Veronica's all about family time. She enjoys golfing, working out, reading, and keeping her violin skills alive as well. She and her husband are raising 3 daughters who are currently 7, 9, and 11, along with their 2 pups, Rocky and Raina. All right, you guys, you are going to learn so much from Dr. Tovar. Let's jump in.
Hey everyone, welcome back to the Motherhood Alliance podcast. We have Dr. Veronica Tovar here back in the studio. Welcome.
Thank you again, guys.
Yeah, absolutely. We have had just the best time chatting about all things nasal breathing, all things airway, all things tongue posture, and just different things that really can help us breathing the right way and just really understanding how airway is so important. So if you haven't had a chance to listen to the first 3 episodes, I highly recommend listening to those. Just a ton of information, and you won't regret listening to any of that.
I would even say not recommend. These are not optional.
Not optional. It is required. So in this episode, we really want to learn more about you. We want to learn about how, you went from your general dentistry, you've gotten experience and extra trainings and certifications, a lot of them through airway dentistry and a lot of different things. So where you are at within your office right now, and where do you see yourself in the future? Tell us about what you offer and how you help people, and where do you think you're going to go with all that?
Yeah, no, I think that's a fantastic, fabulous question because, as I mentioned, my learning never stops.
Yeah.
I am fascinated, and I had mentioned this before, just as you guys are surprised or excited about learning these things, I get just as excited, and there's definitely more to learn. With regards to what I do, I can tell you the restorative aspect of it. I am doing laser dentistry in my office and using 2 different lasers, but CO2 is where I started, and now I'm in the direction of ND YAG and erbium YAG in the office, where I am doing a lot of procedures without any anesthetic in office. But it doesn't stop there. With the laser treatments that I'm performing right now, I've implemented photobiomodulation. And I may have mentioned this in one of the earlier podcasts, but understanding the body makeup and how the fascial system of the body, we have 4 lines of them, they could be responsible for these restrictions that we are seeing orally. And why do I focus on restrictions is because it's what inhibits our body's growth and development. Well, specifically the maxilla and the mandible. Okay. And yes, as a oral physician or a doctor of the mouth, this should be my focus in helping my patients, no matter what age, to help them grow that foundation. Because we know when the teeth are not aligned in the appropriate place in the mouth, that's what destructs them. Whether it's normal wear and tear, and that's debatable what's normal, or if it's excessive clenching, grinding, or doing extra force things throughout the day and night. But really looking at the whole body health with regards to what we can do to release those mouth restrictions. But then I'm actually moving into more into the neurological. I talked about photobiomodulation. Now I'm looking at neuromodulation.
Can you define photobiomodulation first? What is that? When you hear the word photo, are you taking pictures? Like, what is that?
So photobiomodulation is using specific wavelengths of energy from a laser, of course, and one specifically has 4 wavelengths. So this is used a lot in veterinary medicine. So they're using it on our pets a lot more than we are using it on ourselves. It's reparative. It's to decrease inflammation, increase circulation. I use it pre and post my tethered oral releases to help the healing process. I'll even use it on my surgery. So if I'm doing an implant placement, or even patients that I've had open for a long time, I will use it extra orally for muscle relaxation and help infuse. I mean, you want to talk about warm compress and what it can place, what kind of vascularization it can help heal a site. Well, now I'm bringing in that red light treatment.
I was going to say, this
help
sounds like red light therapy.
It is red light, but it's the red light
red
wavelength. Don't be confused with just a red light versus the wavelength with a laser medium to provide that energy that can actually penetrate, not just warm it, but penetrate through the cellular level of the skin or the structures that we're working on. And then to go beyond even doing some neurological stimulation. So I am really specifically getting more into, why did this happen? I'm a root cause individual. And if I can get to the basis, and what I'm learning a lot about is the primitive reflexes and the stimulation of the prefrontal cortex, and how it could, if the body or the brain, has an experience of trauma, that the brain doesn't differentiate between trauma caused from physical hurt or emotional hurt, that can actually set us back neurologically. And with the use of some of these treatments, that we can help reconnect these neural circuits within the brain or from the brain to the body to help the body function as it should. And that can be also including with our sleep and breathing.
Yeah. So what does this look like in your office? Especially this neuromodulation. Like, I get the photobiomodulation, but what about the neuromodulation? What does that look like for somebody?
Yeah, so that's in the early phases.
Okay.
So this is using laser energy.
Okay.
And ideally we'll start at outer meridians of the body that will come up to the head neck area, where we know, off the brain stems the different cranial nerves, and how we can stimulate those nerves from outside and then inside the mouth. Specifically that beautiful cranial nerve number 10, the vagus nerve, to help stimulate the parasympathetic drive within the body for that relaxation, but also to just using laser energy. So we have a light, and it's got a focal point of so much diameter to get to different areas of the body. So extraorally, we're using one hand piece. Intraorally, I have a intraoral piece. But ideally, at the same time, we're also releasing tensions and restrictions within the fascia.
Oh, that's so interesting.
Which is aiding in limiting oral restrictions. Doesn't mean that we're going to eliminate the need for releases all the time, but it's going to at least help with that range of motion. It's going to help with the neural circuitry to retrain the brain, what it needs to do to help promote that tongue placement. Because I will tell you, I talk to a lot of patients, and not everybody can go through treatments, but I will follow up, and they see me for a checkup, and they'll say, you know, doc, you talked about this nasal breathing last time I was in. And believe it or not, I've been really working on putting my tongue in the roof of the mouth.
It's just awareness. It's so great.
I've actually been doing better with doing that. That's them working on themselves. What I want people to know and understand is I'm not here to drive you into my office so I can do this procedure, that procedure. I'm here to tell you there's things you can do for yourself. The brain is ever so powerful to get what we need or do what we need to do. And if we can't quite get there, I can help.
Right.
I can help with more. But I feel like I've had this conversation, but I haven't had this conversation with a lot of folks, is that where there's a will, there's a way. If we tell ourselves, oh, I can't do it, you're not going to do it. But if you say, geez, I know I can do it. I really want to do this. I'll listen to you, doc. I mean, I hear what you're saying. Yeah. And you told me not to clench my teeth, and I'm really trying to pay attention to that. And I have not been clenching my teeth as much. There's that neural connection. They did it themselves.
Right. But you're so good at educating, though, too, because people need to understand the why before they're willing to even do whatever it is.
And then when he comes back and he says, you know, I actually been sleeping through the night. I actually dream. Okay. And when we know that we're dreaming, we know we're getting into those REM cycles of sleep. Those are the rejuvenating cycles of our sleep to get that depletion of toxins in our brain and to repair ourselves ready for the next day. So things that my patients can do for themselves, or even if they're not patients, they're listening to this right now, is like there are things you can do, and the brain is ever so powerful to do it that if you want to do it, you're going to do it.
Right.
Okay.
And you're there for that extra support.
Absolutely.
And education, and just to be there. Yeah.
If we know we have that structural impact, I can help. We have missing teeth. We have cavities. I mean, don't get me wrong. I love the general dentistry aspect of it. Or if we feel like we want to correct that alignment, now that I know that what I'm supposed to do, let's correct it. And now if we want to do the aesthetics aspect of it, because I'll tell you, I tell all my patients, I don't care about straight teeth. It just happens to be the end result when we have your jaw in the appropriate relationship with the right room and space that you need for your teeth and your tongue.
Right.
I want to circle back to that neuromodulation piece again, because you said that it's fairly new. It's coming up in your office, right?
Yep.
Who is that for?
I have to complete case studies, and I'm treating my staff first.
I was going to say she told me about this last time I was like, I'll come in. Tell me when
volunteers.
Yeah, I have to complete so many cases, and have my records and reports on it. But it would be for anybody, especially our babies, because babies who don't come into this world either at the right time or are delivered by a C-section and aren't able to go through their delivery with having all the body movements that it should have, there's a disconnect. Okay.
So you see that a lot.
We do see that. Absolutely. And how that presents, it's really specific to that child, the baby, what position were they in, and to understand that if they're not responding, growing, developing as they should, that there could be that retention of those primitive reflexes, that this is something that potentially can help reconnect those neural circuits to help them move along their normal growth and development stages.
Yeah.
I also, as you were kind of first describing it and talking about how, this is related to our neurological system, this is where people are holding on to past things and it can impact them in so many different ways. Adults come to mind. I mean, which adult out there is not carrying a ton of stress,
Right, or
past
trauma.
trauma or things like that. So is this something where, somebody comes in for general dentistry and you start educating them on this stuff? Is this really something that could be beneficial for pretty much anybody?
And then how often do people do this? Like what's the, like red light therapy or sauna? It should be a consistent, thing that, it's great one time, but it should be consistent over time to really see benefit.
When we're doing our evaluations, and this is what will get outlined eventually, but we do an assessment to see where you're at to start. Are you still holding on to moral reflex, or is there a startle response? Things of that nature to kind of see
as an adult.
where you're at with things. And you'd be surprised how a lot of us still have some of those. And so make that assessment, also looking at range of motion, tongue placement, how are we doing, physically with that. And then we'll put them through a treatment. And once I do this treatment, we'll retest those same reflexes again. Some improve, some not just yet. After a first session, just really depends how much disconnect was there to begin with. But it's like a therapy. I mean, some could, infants, babies, I'll tell you, probably just need one session.
Okay.
Because they're babies. Maybe they need two. But in adults, they may need more, depending on what they've gone through. So it's still very new in my office. So I can't give you like specifics, but it could be one of those things that there is a number of sessions, we'll say anywhere between 9 to 12.
Okay.
And then it's kind of like, okay, how do you feel? I will tell you, I had this done to me, and the initial, I've only had one session, and I don't know, I'm very open-minded, but I would say that I feel like I didn't feel anything. But I would tell you that the people that were also in attendance, and including the class instructor, they're like, you just have a big smile on your face. Like, you weren't like this before. I'm like, I think I'm always happy. No, like you just feel like you're radiating with joy.
Oh, interesting. Okay.
I'm like, okay.
Could all use a little bit more of that.
Yeah, right.
Absolutely. So yeah, it's pretty interesting stuff. It's pretty new. And again, do I feel that everybody has to go through oral appliance treatments or, some of these things are not going to hurt people. They're only going to make them better. This is just another tool that I will be able to offer to say, let's just see what we can do with this and this.
I feel like this would be a great tool to help people. You talk about how it's going to help the fascia and like relaxation and everything else. I'm like working with your chiropractor, working with body work, or,
absolutely,
self-massage or something like that, where that all would really benefit you when you're trying to overcome whatever it is that you're using this tool for.
Yeah, I like to encourage my patients that, I have my scope, let's say, where I'm working, but, as I mentioned to someone one time, it's not like my mouth doesn't make my heart beat. We know we're all connected, okay? Yeah. And I was told, because I did do a lot of referrals to ENTs, and since I've been trained by an ENT sleep surgeon, kind of not done as many referrals, but, when someone came back and said, stay in your own lane, I don't understand that, because our lanes merge. We're connecting, and it's not about staying in your own lane. It's about understanding the complexity and the connections that this has to the rest of the body and the impacts we can have. So, again, if anybody's listening, if you are a body worker, if you're a chiropractor, lactation consultant, IBCLC specifically, because there's advanced training, a speech language pathologist, osteopath, anybody who is cognizant of growth and development, primitive reflexes, the fascial system, reach out to me. I want to refer patients your way. I want your help, because I can't get all that training.
Oh, yeah. You can't be great at everything.
I said when I grow up, I want to be a golfer. But in the meantime, actually, maybe neurology. I think I wanted to go into neurology as well.
Well, you are kind of now.
Yeah.
Well, I am. It's very fascinating, but understanding that what I do within this scope of head neck area, it does extend to other areas. So I will tell you, if you see a chiropractor or a body worker, you get aligned, you get adjusted, you get this work, you feel great, it's going to hold better because we've addressed where it all starts.
I feel like we probably shouldn't dive into a deep conversation, but we probably should say something about like when you said, somebody, ENT or whoever, was like, stay in your lane. I feel like that's a huge problem with a lot of medical dental practice or anywhere, just because, especially like if you go to medical school, right, you learn a very specific area like ENT or, bones or whatever it is, right? But everything is so connected. And if you really want to help patients, you're going to reach out just like you do. You are so willing and want to have people see other professionals that can help them.
Absolutely.
They're only going to get better by you working together as a team and collaborating. And I think that's so important for people to understand, like, if your providers aren't really referring out or like are just kind of keeping you to themselves, I don't know, maybe think about seeing what other options there are too, as far as, different modalities and things. So
definitely expanding. And I say, I love to work with other professionals. And if patients ever have, like, they're not sure and they're getting a lot of mixed messages depending on who they're talking to, I'm like, go ahead, get a second opinion. I spoke neurologically previously, but a lot has to do in that mindset. Is like the patients who get the best results are the patients that want to do the work. You're going to go to the gym. You're not going to just look at a treadmill and burn calories. You're not going to just look at dumbbells and increase muscle mass. Mm-hmm. There has to be effort, but there also has to be desire. So I know I get all ranges of people like, yeah, I'm fine. I'm okay. I'm like, okay. But I'm pretty redundant. Every time you come in and I see and I say, and they're like, yeah, you say that all the time. I'm like, yeah, I'm like a broken record. That's okay.
Well, maybe it'll stick one of these times. So,
but I do get patients like that, and I'll give you a case example, and hopefully that gives me enough time to share this. But I had a patient that I used to see when I was practicing in Green Bay. She's followed me, very anxious, treated her with sedation. Teeth are very sensitive. Mm. I'm like, my teeth are always sensitive. I hate getting my teeth clean, but I only come here to get them cleaned by you, blah, blah, blah. Okay. And I said, you're limited with room and space. You're clenching and grinding a lot, and you're not really using your bite guard, bite splint we recommended. What do you think about just creating some room and space, aligning the teeth a little bit better for you so that, we have bite force distribution and a little balance between your right and left joints and help that not place a lot of load to specific teeth. Fast forward where we're at now. I put her through a liner treatment. Mm. How's your sensitivity? I have none. None?
Yeah.
Like maybe just one tooth?
Right.
No, none of my teeth are sensitive. And I can't say that's going to be the case for everybody, but sometimes people don't know what they don't know or what is possible.
What's possible. They're just used to being the way they are.
Again, and I can't say I'm going to correct every one of your problems because I can't, but we can make you better. We can make things better. And I don't have a crystal ball to tell me what that will be for you specifically, but it doesn't hurt to find out sometimes.
Oh my gosh.
This has been such an amazing series. I think people have learned so much. And what I love about you, Dr. Tovar, is that you're an always learner. And so we could have you back in a couple of years and you're going to be blowing our minds with whole new topics on new things that have come out and certifications you've gone through and trainings you've been at and these new technological things because you're open-minded, you're willing to try these things, you want the best for your patients. And you're just a great person.
Yeah,
well,
I can't wait to see where you're at in a couple of years, too.
Oh, I'm excited, too. But it wouldn't be possible to be putting this information out there if it wasn't for you ladies as well. So I commend you as well. I think this is fabulous that you were able to establish an organization that collaborates like-minded individuals. And that gives me the resource as well for our new moms. It's like, have you ever heard of Motherhood Alliance? I said, look them up. You're going to find other professionals because I don't have all the resources also in my office. There's other providers out there that I don't know of. And if you're listening, well, reach out to me so I can get to know you.
Reach out to Motherhood Alliance, just saying.
But I think this is fabulous that you were able to put this together and have me on to help me share my word, so to speak. I will tell you, I was a little nervous coming in with this because it's like, do you say too much? Do you say not enough? What will you say? Will they, fact check you? But for me, it's not about making you come into my office and see me. It's just about educating, informing, and getting anybody the help that they could use or need.
Yeah. People really feel like that when they come in your office too. There's not pressure. It's just education, and you decide what you want, but they're gonna know about it. So
I will say also, I talked about having a team. I would not be where I am if it wasn't for my team in office as well.
You have a great team.
So a shout out to those guys.
That's awesome. Yeah.
Thank you.
Thank you so much for joining us for all 4 of these episodes.
You bet.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.